Thanks for joining us on this Facebook Live, WMER2 News, partnering up with GBMC for a day of answers. We're with Dr. Amanda Ward today, and we are talking about flu season. Dr. Ward, thanks so much for joining us.
Thanks so much for having me, Kelly. It's great.
We're hearing a lot of things about that this could be a bad flu season. So, a lot of folks still worried about COVID. Talk to us about the option of getting the enhanced booster along with the flu shot at the same time. Is that a good idea?
Absolutely, Kelly. So if you're only making one trip to the doctor's this fall or one trip, to the pharmacy this fall, you can get them at the same time. We are really gearing up for a very severe flu and possibly COVID season as well. So we're urging all people in Maryland to get both their flu and their COVID booster.
What do you say to people who are concerned about the whole safety aspect of getting the two vaccines at the same time?
Sure. So if you've had large allergic reactions to the COVID booster or to the flu vaccine in the past, it might be a good idea for you to separate those two vaccines and get them at different times. You don't have to get them at the same time, but out of convenience, you can.
Mm-hmm. Now, I got my booster earlier when it just came out, and I felt like it was a little too early to get the flu shot. Now, is it a good time to get the flu shot? Are we far enough into the season?
Yes, we want everyone to get the flu shot by the end of October. And why that's so important, Kelly, is because it takes 2 weeks for that vaccine to take full effect. So if you think about the end of October moving into November, that 2 weeks puts us in the middle of November when things really start getting cold, activities at school start moving inside, and then we start gearing up for the holidays. So we want to make sure everyone's fully vaccinated by the start of the holiday season.
So a lot of people asking the question, what's the difference between the current booster and the previous one that I got?
Absolutely. So the current booster, which we now call the bivalent booster, and why we call it the bivalent booster is it actually covers not only the original strain of the COVID virus, but it also covers 2 additional strains of Omicron. And Omicron is really what we're seeing in the population. And so it's not only going to protect you against the original strain of COVID, but also Omicron.
Okay. Talk to us about the flu strain. I know that they're having it pretty bad in Australia right now. What are we looking like it's going to be here in terms of anticipation?
Absolutely. So we typically follow similar patterns to what we see in Australia over the flu seasons. And so we are really gearing up for what we expect to be a fairly severe flu season. We are already seeing patients be hospitalized in our hospital for influenza, young patients, which is surprising. Usually we see an older population be admitted, but we're already starting to see it within our community.
What about children? I know my daughter's college campus there, which I was very excited to see that they are doing the enhanced booster, as well as the flu shot. Is that something that we're going to see more of?
I think so. I think we're really trying to push it, get it out into the community. Anyone who's 6 months and older qualifies for the flu vaccine. So as long as you have a 6-month-old or older, they can get the flu vaccine. We have multiple manufacturers who make the flu vaccine. So there's different types of flu vaccines for different age categories. And when you go to see your doctor or go to the pharmacist, they'll know which one you qualify for based on your age.
Mm-hmm. Now, I know my parents get the flu shot every year. We get the flu shot every year. They're doing something a little bit different. CDC making a different recommendation for folks over, 65?
Yes, that's correct. This is really exciting this year because typically of the patients we see hospitalized from flu, and a big proportion of the patients who end up dying from flu every year are over the age of 65. And so what we've done this year is created 3 new vaccines for the flu that really cater to patients who are 65 and older. Patients who are 65 and older, as we get older, our immune system just gets weaker. And these are called high dose flu vaccines, meaning that they provide a lot more of the flu particles that are needed for our body to respond to it. So this year it's really exciting because there's an option of getting an enhanced booster or high dose booster for the patients who are 65 and older. And we hope that will keep them out of the hospital and will keep them from dying from this illness.
Any negative reactions so far with folks getting the flu shot?
So every year, we take precautions as to what side effects patients may experience from the flu. The typical side effects that patients may experience are, soreness in their arm where they had the flu vaccine injected. You might feel fatigued or tired for the day. Some people get some nausea or vomiting, but there's rarely any severe side effects to getting the flu vaccine.
So what do you say to people who say, oh, I got the flu shot and I got sick, it gave me the flu? You hear that every year, I'm sure.
We do. People always ask, can I get the flu from getting the flu vaccine? And the answer to that is no. If you experience a day or two of symptoms that mimic the flu, it's just because that's how your body's immune system is responding to the vaccine. And that's normal. And that's what we want your body to do. That's
Mhm.
how we know that when your body sees the real flu, then you're going to be able to fight it off.
Now, is there any reason why someone shouldn't get the flu or the COVID-19 vaccine?
So that's a great question. So if you've had severe allergic reactions to the COVID-19 boosters or injections and the flu shot in the past, you really should consult with your doctor regarding how you should go about getting these vaccines. You may need to get them in a controlled setting in your doctor's office or in a hospital setting. So if you've had severe, meaning, your throat closes up, you can't breathe, we call that anaphylaxis. If you have those types of reactions in the past, you should be very cautious. But otherwise, the flu vaccine is a universal recommendation, meaning we recommend it for everyone.
Mm-hmm. A lot of folks are worried about the flu shot, not the flu shot, but getting the flu versus getting COVID. Are the symptoms it seems like there are some similarities between the symptoms.
There can be a lot of overlap between feeling the effects of the flu or COVID. There are a lot of overlap. So it could be difficult to tell maybe how you're feeling. And so you can test for both the flu and COVID.
Mm-hmm. And I guess the big concern this year, why it's so important and the big push to get vaccinated for the flu as well as COVID or the booster is, I guess, if you get hit with both, it could be a real whammy.
Absolutely. Absolutely. And especially for patients who are over the age of 65 or patients who are taking medications that suppress their immune system and they don't have a good immune system to fight off these viruses. One is enough, but having both at the same time could really cause, you to be hospitalized. And we take that very, very seriously.
So if you didn't get any of the vaccines, you still have to start with the original series of 2 and then do the updated booster. How does that work?
That's correct. So you would still get your initial 2 vaccines of the COVID, and then you could get your booster later down the road when your time qualifies.
So, and what's the time period that you have to wait in between?
So in between getting the primary series and getting your booster, so typically this booster we're really, really encouraging people to get because it does cover that Omicron variant, and the initial series does not cover the Omicron. So after you got your primary series, the CDC is recommending waiting about 2 months to get that bivalent booster. And if you just had a booster, let's say over the summer, as long as it's been 2 months, you can get that bivalent booster. We really want our community to have that bivalent booster because it does cover Omicron.
So at this point, do we know if this is something that we're going to have to get every year, or, in terms of, is it going to become like the flu shot where you have to get the vaccine for COVID every year, or is it still too early to tell? I know you said we're still learning a lot.
We are still learning a lot. And I think that's a million-dollar question, as if this will become a yearly vaccine for all of us. It looks like it may be, but I think the verdict is still out on how this cold and flu season goes and the next few. But I anticipate that we will add this vaccine into our annual regimen.
Mhm. We're on live now with Dr. Amanda Ward from GBMC. If you have questions, leave it for us in the chat, and Dr. Ward will answer them for you. So chime right in on our Facebook Live. Dr. Ward, what is your biggest concern about this upcoming season?
So I think my biggest concern is just there's a lot of hesitancy to get the vaccine. And I can't stress enough how important it is to do primary prevention. The vaccine is preventing you from getting so sick. Where I work in the hospital, so I'm a hospital doctor, and I get to see after the fact when patients are already sick and sometimes already too late. So I can't stress the importance of doing this early and getting vaccinated, protecting yourself before it's almost too late.
Hmm. I know there's a concern with the colder months, and a lot of folks thinking, "Hey, the pandemic is over. I don't have to worry about it." It almost kind of seems like people have let their guard down a little bit.
I
I've
think
had to
so.
back off, making sure I was having that 6 feet of distance and a couple of folks, because a lot of folks aren't wearing masks anymore. It's become a common practice.
Yeah, I think since universal masking laws have gone away and kids are back at school, we know that things like influenza and COVID move around quickly among children in schools, and then they bring them home to their parents and grandparents. So with those kind of changes in our environment over the past year to 2 years, we really do expect there to be quite an uptick in cases this cold and flu season.
And a lot of that kind of starts with kids back in the schools, spreading the germs and bringing them home to parents and grandparents as well. So if your child comes home ill, under the weather, how do you know if you should test them for COVID or the flu?
That's a great question. And so it's hard to tell. Like we were speaking, earlier, a lot of those symptoms overlap. And so it's really important that if they are sick, to keep them home from school, to
Mhm.
prevent the spread of those viruses within the school community, and have them see their pediatrician and get tested. We do have enough tests at this point to test for both flu and COVID in the office. So it's a good thing to get tested.
Are you seeing a lot of cases yet?
We're seeing definitely an uptick in the hospital for both flu and COVID. So over the summer, we had a nice lull in cases of people being admitted to the hospital, but now with the colder months coming, we are starting to see more and more.
Now, when does flu season typically run through? And another question, well, I'll let you answer that one first, and then I'll answer. What does it run through?
So typically it runs through about March
Mhm.
in this area. So each climate has a different kind of time frame for the flu season. Ours is typically October to March, maybe even into April.
Now, what do you say to people who says, "Oh, it's too early to get the flu shot"? Because honestly, I kind of thought it was early to get the flu shot when I saw the push coming out early.
Sure. Yeah. No, this is the right time. So back in July and August, that's too early. When you
Hmm.
start hitting end of September into early October, by the end of October is when we want everyone vaccinated.
And what about the concern of folks that they may have to get a second flu shot? Because I've heard of that as well.
So that's typically in children that we see that they need to get their second flu shot if they haven't had a flu shot. But in the adult population, it's primarily that you just need one flu shot this season.
hmm And I guess what kind of precautions? I know we tell people that over and over again, but maybe we can use this time for you to reiterate some of the things that people need to do to stay healthy and stay safe.
Sure. I think, the things that we did during COVID definitely work because we didn't see a lot of influenza over the past 2 seasons. We
Hmm.
saw primarily COVID. And so things about wearing a mask, making sure you're in nice ventilated spaces when you have a large gathering. If you're having a large gathering, if you can keep it outside for as much time as possible or keep doors and windows open and let air circulate through. If you're going into an enclosed space, it is a good idea to wear a mask, especially if you're above the age of 65 or you're on those medications that are going to suppress your immune system. It's really important to take those simple, what seems so simple, but make really big impacts. And of course, good hand washing. We
Mhm.
can never stress enough good hand washing, and either with sanitizer or with soap and water. Both work against both the flu and COVID. So you can use either.
So basically, don't forget everything that we've been doing over the last 2 years.
Absolutely. Absolutely. One of the questions that I always get, Kelly, from my patients is, I have an egg allergy. Can I
Mhm.
still get the flu shot? Because it used to be that, there were egg particles within the flu vaccine, and that's actually no longer the case. So we really do try to encourage, if you have an egg allergy, you can still get the flu shot. And I think
Mhm.
there's been a lot of misconceptions about that over the past, 10 years or so. So we really want to make that known to everyone.
Mhm. Well, right. And I noticed when we went to get when I took my daughter to get her first shot for COVID, that was one of the things that they asked, making sure that they wanted to be aware of your allergies so they could have maybe a special area for you, or that they could pay close attention to you to make sure that you weren't having a bad reaction.
Absolutely.
All
Yeah.
right. Dr. Amanda Ward from GBMC, thank you so much for joining us for this Day of Answers as we get ready for flu season. Hopefully, everybody will take your great advice and be prepared to be safe this season.
Thank you so much, Kelly.
Thank you, Doctor.